Okay, we are recording. It is September 19th. It is SERP 6, session 7, I believe. And I'm sitting here with Dr. Campus. He's holding his slate, and I'm going to ask him a few questions about the SERP program. Thank you. Okay, Dr. Campus, can you explain what dental implants are?
Dental implants are basically a replacement for teeth that are basically the same size, the same shape as the root of a tooth. The advantage to a dental implant is that in replacing teeth is that we place it in there, we're able to do different things to it. We're able to put a single tooth on it. We're able to use that implant as an attachment for a partial denture or a complete denture. So it's a small titanium threaded screw basically that has multiple options on how to restore the teeth and how to replace the teeth that we place into the bone very easily, and it's very predictable.
Okay. How are dental implants beneficial to patients?
There's a lot of different things that I tell my patients that are advantages to implants as opposed to a traditional bridge or a partial. Most importantly, it's going to preserve bone in that area. The way the body works is if you don't use bone in a particular area, you lose it. And so over time, if a tooth is missing, you will eventually resorb so much bone that it requires additional procedures to make an implant work. The advantages to implants over a bridge is that it's much more natural. Compared to something removable, you can floss, it's easier to clean and floss around it. Just much more beneficial long term than some of the other more traditional means of replacing teeth.
Why is it important to operate in the United States as opposed to, say, a different country?
That was one of the big things for me with SERP is that I live in Florida. It's about a 3.5 or 4 hour drive for me to come up here, but not just geographically. I mean, the travel is easy. You don't have to worry about customs and passports and things like that, but also safety concerns. You're not going to a place that you don't know people. I mean, no one wants to walk into an uncomfortable situation. But more importantly than that, it was important for me to do it here where it was relevant to, I'm a licensed dentist in Florida. I have a temporary license in Alabama, but at least it's all basically the same. We're all trained the same. It's the same standard of care, and that was important for me to know that we were doing things the way they needed to be done, obviously by the patient, but also for myself for consistency that I can take these things back home to my own practice.
Why is it important to operate on the live patient?
There's just no replacement for it. I mean, there's nothing that you can do on a model or on a pig jaw that is the same. I mean, when you go and reflect gum tissue back, you've got bleeding, you've got saliva, you have all these things that you face on a daily basis in your practice, and doing it on anything other than a live patient, while it can be beneficial to learn and get some experience in as far as the types of instrumentation, the types of procedures and products to use, there's no substitute for actually using it in a patient to see how the bone responds, how the tissue responds, and how the patient responds. I mean, that's the beauty of SERP is you're actually able to talk to all these people. Yes, some of them are sedated, but a lot of these patients we're able to talk to them after the procedure and learn what they thought it was going to be like. Did we meet their expectation? You know, what was it that we did that was different? What did we do that they didn't like? Or, you know, hopefully we meet or surpass their expectation. And so doing that on a model just doesn't do it any justice for what we're able to do here.
How is it beneficial to learn under experts such as Dr. Mike McCracken and Dr. Guy Rosensteel?
It's an incredible experience. I showed up here. I've spent hours and hours and hours in continuing education, traveling all over the country on implants from a restorative standpoint, also from a surgical standpoint. And I thought I was pretty well educated. And I think for the courses that I did, I was pretty well educated in what I'd been through. But within the first session, we pretty much eclipsed and went way above and beyond the stuff that I knew. And I realized very quickly there was a lot that I didn't know what I didn't know. And so it blows my mind and amazes me that they're at the level where they are, where every time we come in, every single month, we're learning about things that we didn't even know were on the menu. And so it's been incredible. I couldn't imagine doing it any other way.
What benefits do you foresee by taking the SERP affecting your practice?
It's been phenomenal. I'm able, with where my practice is located, I'm on the outskirts of a fairly decent sized town. Have a pretty big elderly population, lots of retirees, and the closest oral surgeon's 45 minutes to an hour away, and I kept referring and referring and referring, and I had so many patients that weren't following up. They weren't going to see those specialists, not because they weren't good specialists, but and even though I would try and try to get them to do it, they just didn't want to travel. They didn't want to be ping pong back and forth between specialists and the restorative dentist, and so that's what really opened my eyes to it. And so I've seen a really big big satisfaction with my patients, that now that I'm placing implants, and I've been doing so in my office, it's been tremendous for the patients, for everyone in that area, and it's just paid off fantastically. I mean, I've really enjoyed it. From a business side of things, which is something to look into also, the production and collections have gone up dramatically. We're not even almost done with this. We're pretty close to being done, but I have paid for this course times about 6 right now, and so we're not even finished with it. So it's been a tremendous impact for the practice and for all my patients, and best thing I've done from a continuing education standpoint.
So it sounded like you were placing implants already. How much new information or new techniques did you gain through the CERP program?
Night and day difference. I was placing in an abundant bone situation, and the healthiest of the healthy patients that were very easy cases, and really intended on coming here to just make me more comfortable with those types of scenarios. Whereas now, all the things that I didn't know that I've learned, now there's really not much at this point that they haven't taught us, that I know of, that we haven't learned, that I wouldn't feel comfortable doing to my patients, the treatment that I wouldn't feel comfortable providing. So the amount of knowledge after even the first meeting here just blew by everything that I learned previously. So just a tremendous amount of information.
How is CERP different from other dental implant courses?
Having been to mostly restorative courses, a couple of surgical courses, I would say the advantage of this is live patients here in the U.S. You're treating a population of people that really need it and really appreciate it. That's a very unique thing. With Dr. Guy and Dr. Mike, very unique skill sets and backgrounds between the two of them. That carries a lot of weight with me. And also being able to bring in the personal component of helping the people here in Bessemer, on top of that learning the surgical skills and also the restorative skills. We're not just learning about how to place the implant in bone, we're learning about how to restore the case. And also the benefit of being able to follow up with these patients, because they are here in the U.S. We're able to find out when we come back from month to month, we can go back and look and see how they've been doing. And so it's been really interesting to see how patients that may have placed a simple implant in 4 months ago, now they've had 3 more placed since then, and you finally get to see these patients go with their appliance in place. So it's a pretty cool situation.
Can you tell us a little bit about the clinic and the staff?
The clinic is very impressive, for especially being fairly new. I know it hasn't been here very long, but it has got everything you'd ever need. It is laid out very well. Can certainly do a ton of treatment in this place, and the staff is incredible. I mean, between the assistants and the front office people, everybody here has made it so easy. They're extremely respectful. Everyone from the assistants, front desk people, the residents that are here, they just kind of roll out the red carpet for us and really take good care of us and make sure that we're doing the things that are right to do, things we need to do, and things we want to do. So if there's a case or a type of case we want to do, we let them know now, and by the time we come back next month, they do their best to try and find that particular type of case and that patient so that we can do it. So they've really bent over backwards to make sure that while we learn everything and learn the standard of care with implants, they're also doing everything they can to really fill those voids or those gaps that we may feel like we're a little deficient on. Something we covered 3 or 4 months ago in lecture, and we're a little rusty on it. We ask them about it, and they are more than accommodating on those situations.
Are there any other comments or anything you would like to say at this point?
I would just say that if something tells you that implants are going to be successful in your practice, and you want to get into placing implants and you want to be able to help your patients with that. I've done a lot of research at places all over the country, all over the world for implant placement, implant surgery, and restorative dentistry and implants. And if it's what you want to do, this is the place to do it. I have not heard or seen of anything that is more comprehensive, more thorough, and that has better expertise in teaching it. Not only are they really good at doing the procedures, they're incredible at teaching how to do those procedures. So I would just say do it. You know, don't wait around anymore. Just do it. If it's what you want to do, it's a big commitment, you know, but it is worth every penny of it, and it's worth all the time.
Thank you for your time.
No problem.